morning, ladies and gentlemen. This one a Pidgin News event and entertainment channel. So today we don't carry another Ogbonge program, come show una today. So for inside Gisme TV, we dey do different things which una know. So we dey hammer Pidgin English, we dey hammer grammar, and we dey bring all events, all entertainment, interviews, and other programs. So today we get our doctor, we get our pharmacist, and we get our CEO with us here that will be teaching us, we'll be learning from them, and our viewers, you'll be learning from her, you'll be learning from everyone today regarding an interesting topic that says HIV AIDS does not kill, but the stigma and rejection kills faster and more. Stay tuned. All of your questions, bring them because we are packed today and we are ready to answer all your questions. Some of us have questions like, can a HIV patient get married and have children? Can they eat with other people? Can they sleep in the same bed? Can they live in the same house and all of that? So get ready today, bring your questions, and our doctor and our pharmacist and the CEO Joyce is ready to answer all of your questions today. So stay tuned as I introduce them to you. Lady Joy Mensah from Ghana, you're welcome to the studio.
Thank you.
All right. So today is your day because we want to hear a lot from you.
Yeah.
We heard your story and we want your story to encourage other people. Because in this world, so many persons are thinking that they are alone. But your story will change their mentality, will let them know that no, they are not alone. All right. So we want to really appreciate you for giving us this opportunity to have time to interact with you. And
thank you so much.
All right. So I'm going to introduce another important person. He's no other person than Pam Isaiah Oko. He's based in the USA. He's a pharmacist. He's a well-known pharmacist, a good one at that. So I will let him do justice to introduce himself better and also introduce our doctor. Pam Isaiah Oko, you're welcome to the studio.
No, or we are live now.
Yes.
Okay, my name is Isaiah Oko. I'm a general practice pharmacist in the United States. I have practiced in Nigeria as well before I moved to the United States, and I have a total experience in the practice of pharmacy for 21 years now. And I would say that the topic of discussion today, HIV/AIDS, is one of the areas which is infectious diseases that I practice in, and I have several patients in it. So I thank you all viewers, and I hope you will enjoy the program today.
Thank you very much, Isaiah Oko. And also, I want you to do us the honor to introduce our able doctor.
Okay, let's see. Okay. Thank you, viewers. The person you are seeing right now is Dr. Henry Onyemari. Dr. Henry Onyemari is a licensed doctor in Nigeria who have so much experience in infectious diseases as well, of which HIV is part of it. And Dr. Henry Onyemari is a doctor at the Asaba Specialist Hospital in Asaba, and currently in the Department of Obstetrics and Gynecology. So being in obstetrics and gynecology, he deals a lot with infectious diseases, especially with females who have, including HIV, and those who are about to give birth to children. He has so much experiences with it, of the single and married ones who come to the hospital and who are married to and who have children and they have HIV as well. So he has a wealth of experience and has practiced now for years.
Thank you very much. Dr. Henry, you're welcome to the studio.
Thank you very much.
All right, so can you increase your volume a little bit, please? All right, so before we dive into the questions, I would want Joyce to do us the honor to introduce himself properly to our viewers. Oh.
So.
Okay. Yeah, she's right back. Okay, so can you please introduce yourself to our viewers?
Okay,
They are longing
okay.
to see you and they are longing to hear from you.
Okay. Yeah, since I signed,
I go dey very, very happy. I wish I go chop with Mercy Johnson. Mercy Johnson go chop with me for inside the same bowl. I wish to chop with Iniedo. I love her so much. I won't make Iniedo chop with me for inside same bowl. I want chop with Don Jazzy. I love him so much. My name is Joyce Mensah. I be HIV positive. I dey live for Germany. I be Ghanaian, but I fit speak pidgin English well because I dey love watch Nigerian movies. I be actress. When I dey do HIV program for Ghana about 10 years ago, I come meet one Nigerian man. His name na Mr. Lolu Akindele. This man supports me well. I come promise am say one day I go Nigeria, go educate my people for there. Now, everybody knows say the HIV no dey kill because we get medication wey people dey take. Me, I dey take my medication every day. But the stigma and the rejection wey dey kill people no be the virus. So, I come register an organization called ACAF. I come get certificates, meaning I go travel everywhere, come dey educate people about HIV. My main aim is say I go educate the pikin where they go school, make them know say HIV still there around. I get mine through sex. That be why I dey target the young people. They tell them say make them no do wetin I do wey make me get the HIV. I get them for church. I dey sing well for inside church choir where one of our members carry the disease. He know say he get am where he dey spread am. That time I be just 19 where he can't give me the virus. But now I dey want educate people, make them know say if person gets HIV, if you chop with them, you no go get them. If you sleep with them on the same bed, you no go get them. If you marry them, born pikin with them, you no go get. Pikin no go get. You no go understand now, but if I take time explain, you go understand wetin I dey talk. My people, this be the time Africa will for unite. These people bring many diseases, but Africans they suffer most. HIV wey dey everywhere. Many people get them. They know they reject them family members, but only we Africans. When African person get HIV, him mama go fit throw am for house, him papa go fit throw am, but Oyibo no dey do so. Make we wise up. So, I can't do program for Ghana for many years. People can't support me. Some people no agree with me, but some agree with me. I can't do program. People they fear say if person get HIV, you chop with them, you go get them. It no be so, because the HIV no dey inside saliva. That be why this man for Ghana, where they do charity work, his name na Ibrahim Quantin, come visit me for my village, come chop with me. The whole world shocked, say this man chop with me. Ah. Now actor Kofi Ajololo will be my body, my friend, come invite me for house. As you dey see for the video, he chop with me. Make people understand, say, if person get HIV no dey inside for air. HIV no be anything where you go fit get where you chop with person. For you to understand, say, HIV no be disease where you go get when you dey chop as person wey get the virus. I fit cook for you, you go chop, nothing go happen. No be so person dey get the virus. Na sex, I say waiting. 80% of people wey get HIV, they get them for sex. No be say they go chop with person wey get HIV. My people. Now, this organization where me be the president, is called ACAF. ACAF means African Community AIDS Foundation. If you be church where they inside Germany, you fit call this number where they the screen. You go visit every church. You no go pay anything, no. You no go pay me anything. Aha. You know what thing I want to do? I want to sacrifice my life. Make people learn. So you see, say, all these people come chop with me. Make you know, say, if you get person will get HIV for your house, you fit chop with them, nothing will happen to you. Okay? So Kofi Ajololo chop with me. Mr. Ibrahim Kwanti chop with me. Now I have a request. I won't come Nigeria. Now I dey inside Germany. I go dey very, very happy. I wish I go chop with Mercy Johnson. Mercy Johnson go chop with me for inside the same bowl. I wish to chop with Iniedo. I love her so much. I won't make Iniedo chop with me for inside same bowl. I want chop with Don Jazzy. I love him so much. I want chop with Ngozi Ezienu. I want chop with Kanayo O Kanayo. I want chop with my friend Zab Oji. I want chop with handsome Frederick Leonard. I want chop with Jim Ike. I want chop with Ramsey Noah. In fact, I want chop with all the actors for inside Nigeria. Hey, that day, I go dey very happy. Please, my mission be say, I want help make people no get the virus. Like I get them where they give me so much problem. I suffer so much rejection. Where make me, I can't get depression. So for now, I dey take medicine for HIV for life. And I dey take medicine for depression also. Any church where they inside Germany or any part of Europe where you won't invite us, I get team. I know they work alone. Please, we know they charge you anything. You fit call, you fit send me an email on joycehiv.ambassador@gmail.com. The number be +491 72 353 4706. Make I dey repeat am. 00491 72 353 4706. May God bless una for me. Bye bye. It is real.
is a kill. Be careful, be careful, be careful. It is real, it's a kill. Be careful.
All right, thank you very much. That was a video. That one a video from Joyce Mensa. In fact, when we watched the video finish, the thing touched me for heart well when she did make her wish. She say she wished to talk with other people. The main reason for that video not be because say she just wished to talk with them, right? She want remove that mentality from people, most especially the African people. Say if you eat for inside the same plate with anybody wey get HIV, not mean say you go carry the HIV. That one are the main purpose of that video. So our viewers wey dey watch am, make una understand am, so that una go know why she actually do the video. Because if people come begin see her dey eat with other celebrities like that, dem go actually understand say yes, AIDS or HIV e no dey for inside you drink water, I drink water, you chop for one plate, I chop for one plate. No be so e dey be. And she make one comment say the way wey e be for Africa, no be so e be for outside Africa. Wey e be say if person get HIV AIDS, family go reject you, dem go just throway you like say you be piece of rat. Okay, so I no be specialist, make I leave am for the people wey get matter. All right, so right now I want to give the opportunity to Dr. Henry to educate us more on the questions about HIV AIDS. So Dr. Henry, you're welcome to the studio.
All right, good day, everybody. First, I want to start by appreciating the organizers of this program, talking about Mrs. Rosalie, and also, more importantly, to the person that volunteered.
All right, so before I come back in, I won't bring our sister again because she was trying to tell us something before. All right, so let's hear you. I just pray that your mic is okay now.
I hope so too. Is it okay?
Yes, it's better now.
Very
Reduce the volume.
Okay, okay.
All right.
Is it okay?
Yes, it's better.
Perfect.
Good, good. So I was introducing myself when the internet, the network was messing. So I was ambassador for Ghana for many years, and having at the time I was very young. I was only 24 years when I started in people. I got infected at the age of 19 in a church choir, and I got it through sex. Lucky for me, I got it because many people, when you ask them how they got it, they'll tell you they don't know. Maybe they got it in a salon or somewhere. But luckily for me, I knew how I got it because I became pregnant at that age. Went to antenatal, and those days, if you are pregnant, as of now, it is mandatory to go through HIV test. The reason is protect every unborn child from getting any kind of infection that the mother has doesn't mean the child should get it. And so I got tested, and I tested positive. And at the time, the one that I was pregnant with was very, very ill. So prior to getting that pregnancy, he had told me severally to abort the pregnancy, but he was not bold enough to tell me why he wanted me to get rid of the pregnancy. But I thank God that I kept that pregnancy. I always say how that I gave birth to is my savior, because there was never going to be any reason for me to even go for an HIV test. I don't think anybody convinced me while growing up to do an HIV test. It is a test that I would never have done willingly. So I did a test, and that was on the 10th September 2007, and it came out positive. It was really traumatic. And then died before I had the baby in November in 2007. But I thank God that the child is 13 years. This year he's going to be 4. He tested me 30 when he was 6 months, And in Africa, they will tell you to repeat the test when the child is 1 year, tested negative when he was 1 year, and 1.5 years, again, he tested negative. Before I
Wow.
was okay.
That's good.
Yes.
Oh.
Because if looking at the time I tested, it even delayed because they told me from the beginning to do the HIV test. I was refusing because I was scared. So the pregnancy even got to this month before I tested. So the antiretroviral drug was given to me only within 2 months, and then they gave me a tablet called. They told me when I'm in labor or when I'm going to have a CS, the Nivara, there was just one tablet to protect the baby. So I did that. And when the baby came out, gave me some medication for HIV syrup. I think that was used as a post-exposure prophylaxis for the baby. So I gave it to the baby for 2 weeks just to make sure that the child is free. So he will be 14 years now. And I went on to have another child. She also came out negative. I went on to have another child, also negative, and I went on to have another child. So I have four children who are all
4 children. Oh my God.
yeah,
Wow.
yeah,
Wow. Isn't
yeah.
God great?
God is wonderful.
All right, go on.
So, but then people didn't really believe that this was possible. So if you follow my story, if you go back about 2 months ago, I flew to Ghana to conduct an HIV test for my children on live camera when I invited all the media to come because the child from where my daughter was schooling, they had sacked her from the school, claiming that yeah, I am HIV, she probably have the virus. She doesn't have it. So to prove that a mother can have negative children, I flew from Germany to Ghana, did my own HIV antibody test, showing positive. My 2 children tested in front of camera. And people were amazed because these are the questions that come every day. How is that possible? How is that possible? Because the child was in your blood, in your stomach, you gave birth. How are you telling us that you have? This is something people don't want to believe. They don't want to understand because in the past, HIV was a death sentence. And now the advanced medication, which is the antiretroviral drugs, which is serving as treatment as prevention because condom is no longer working. So when we get many people who are put on the HIV medication and they adhere to their medication like I have done, and their CD4 is very high, viral load 0. Now my viral load is undetectable for the past years now. It is not easy to achieve this because I take my medication every blessed day. I don't develop the habit of, oh, I have forgotten. Oh, I'm feeling lazy. Oh, it's too much for me. No, I want to. So I take my medication. So I believe that now that there is COVID-19, I see that they update us every day. That this is where it has gotten to. If you want to travel, you have to make sure you do the COVID test, get vaccinated. But HIV wasn't treated like that. When they realize that the medication has been advanced, even to the point that when you are undetectable, untransmittable, that is what WHO says equal to you. To you means undetectable, means untransmittable, meaning if the thing cannot be found, you cannot give it out. And this is a topic that is very difficult for people to understand. How can you tell us that HIV, and then because you are on medication, you cannot give the virus? And people say it is even possible there is still virus, tiny one hidden somewhere. Nobody is safe, but everybody is safe. For a German doctor to tell me that my partner is safe with me with condom, Germans don't jeopardize people's health.
Of course.
No. German doctors, they are professional about America. Germany, they will not ask to jeopardize with somebody's health. To the point that the doctor told me, if my partner doesn't understand, I should the hospital. A doctor opened his mouth and told me, now we have monitored you for many years. Never been a day since my viral load has been undetectable. There have never been a day where they said now we have maybe 100 virus or 150 virus. People have gotten even 1 million viruses in their blood. Ma is undetectable. So at this point, I think this is the end that has to. Oh, who is calling? Sorry for that. People every second. So this is the. I think
We can see
my
your face
camera went.
anymore.
Can
Yes.
you see me?
Yes, we
I
can see
think
you now.
the
Yeah, we can see
undetectable
you.
equal to untransmittable. People need this education. People need this education because people don't understand how they can eat with me and they will not get infected. But here lies the case: if you have COVID-19, if you have coronavirus, you cannot
Can you
even
please
travel.
rotate? Excuse me, can you please rotate your camera?
I think because a call came in and I tried the call, it's interrupted my video. Maybe I have to go and come back into the
Yes, you
video
have to
again.
go and come back, yeah.
All right,
Because you're
all right,
facing upside down.
okay.
When she
All right.
leaves, you can be playing her story.
Okay, so before she comes back, the first question I was going to ask Dr. Henry was to tell us the meaning of HIV AIDS, because most people know it's a virus, but they don't know like what is it, what is this all about, what's the meaning. And so Dr. Henry, if you can hear me, if he cannot, Famazaya, you can please tell us. Okay, she's back.
She's there,
Okay,
and Dr. Henry is there as well.
yeah, but it looks like his camera is frozen or something.
Really?
Whose camera is frozen?
Not
Dr.
yours.
Henry?
Yeah, continue, not be you. Oh yeah,
Okay.
go on.
So I even forget how they speak pigeon. CBT trouble. So people for understand say person will get HIV when you virus no they show again. It means undetectable. Person who is undetectable cannot even pass on a virus to her unborn child. She cannot pass on a virus to her. That's why it is possible even for positive people, negative people. It is very difficult, and because I'm telling you, I'm saying it sounds so simple, but it is for somebody best accept because the topic that took some of us many months to in workshops to be able to understand and to be able to teach others.
Okay, so viewers, we really apologize for the technical difficulties. I beg, make una not worry. Then go come back, then go fix the whole thing. So now not say these things where they use, where we both do for us. Sometimes the thing they misbehave. All right, so I go call on Famazaya to please explain to us wetin be HIV AIDS. Explain am for us, I beg.
Viewers, thank you for watching and listening. A HIV is a virus that causes AIDS. Just like we have different kind of microorganisms that causes diseases, HIV is in the virus family. And the full meaning is human immunodeficiency virus. That is HIV.
Human.
Now, immunodeficiency virus.
Okay.
So just like the Plasmodium falciparum causes malaria, human immunodeficiency virus is what causes the sickness or disease called acquired immune deficiency syndrome, which is AIDS. So HIV is not AIDS, but that is the virus that causes AIDS.
Okay.
Just like the Plasmodium falciparum is not malaria, it is the microorganism that causes malaria.
Okay.
So not everyone that have HIV have AIDS. AIDS is a disease. HIV is a virus. So the way it is the virus have the potential to suppress all your immune system and your body will be prone to diseases. Then at that point, you start having skin infections because your system is now open and prone to fungal infections. At that time, you might have a pneumonia because your immune system could not combat the pneumococcal bacteria that is attacking you. You start coughing. At that time, you could have different sicknesses because your defense system, which is your immune system that fights the microorganisms that cause you disease, have been suppressed. It's just like somebody come and demolish your fence. So thief, any kind of thief can come through the back door, the window, the front door. So as we live our life every day, we have a defense system in our body that prevents us from having infections. It prevents us from having a respiratory tract infections. It prevents us from having a dermatological skin infections. It prevents us from different things. But when the virus gets into your system, it goes into your blood system and suppress all those your defense systems. Then it's at that point you have why they call it acquired, because it is not natural. There are different kind of immunosuppressive disorders. Some of them is not acquired, but because they call this acquired, is because maybe it is transmitted through sex. That means it was something you acquired. It was something you made an effort to go and get. So when that happens, the virus start destroying your immune systems. That is when you have a problem. That is when you have a sickness. But like the Miss Joyce said, if medications are able to suppress the virus and reduce the viral load in your blood system to the point that your immune system is not suppressed, you will not have AIDS. Yes, you will test positive to the virus, but you will not have AIDS. You will not transmit it to people. You can eat with people. You can associate with people. You can hug them. You can kiss them. You will not transmit it because your viral load is basically zero, or what we call insignificant. Because for even a microorganism to cause a disease, even for malaria parasites to even cause you malaria, there have to be what we call the serum level. There have to be a level of that organism in your blood system. So when the HIV virus is reduced, maybe from medications, is suppressed to the point that the concentration in your blood is not even able to show, you cannot actually transmit it to your children, because the only way you can transmit a disease to unborn children is there is what they call the placenta barrier. That is where you supply blood to your children who are growing up. And the children have their defense system as well. So their natural defense system will fight it. And when they are born, it is reversed. They don't have it. So, but for that to happen, you, the patient, will have to have been in a system. Maybe you are constantly taking your medication. Okay. And that is where I come in as a pharmacist. We have what we call medication therapy management, because why medications don't work most times in Nigeria or Africa, it's not because the medication is fake, it's lack of compliance. Because people only think they are sick when they have symptoms.
Okay.
So many people start treating HIV when they start having cough, when they start having rashes on their, when they start having symptoms. But if you are somebody who can be compliant, take your medication every day, and go for maybe test every 90 days or 30 days, they take your blood level and see that your serum concentration of the virus is not able to cause a disease, you don't have a problem. I have many HIV patients as patients here. There are many. I have many of them that have 4 children. Some of them even have 8 or 10 children. They are here. So they have been living, especially the men, with different women anyway. And the women did not contract it. The children did not contract it because they are not transmittable. They don't have enough in their system to transmit it. So that's what it is.
Thank you very much, Farmer Zaya. How I for fit come out now, can't they explain waiting and not know to everybody? That's why then they talk say, who get person pass who get money. All right. So Famazaya, thank you very much. So I would allow Joy to continue with her story before our able doctor go explain to us the remaining parts of the whole thing. Okay, so Joyce, over to you. Let me believe that this earphone or whatever go let us hear you. The world must hear you, whether the devil likes it or not. They must hear your story, and they must believe and know that you are not alone, and they also, some of them in your shoes, are not alone too. And they not see as you fine, as beauty just carry you, All right,
Thank
over to
you.
you, my darling. Go on.
Okay. I am so glad to hear from Miss Taya to explain the public because I have been explaining this for more than a decade. By time people think that when you are speaking, you are speaking out of to get sympathy for you, or out of selfish interest. Let me use the word interest. They think that if you are saying undetectable, I mean, if the virus is undetectable, it means you cannot transmit it. They think because you are looking for boyfriend. Like I always post on
Oh.
my Facebook. Yeah, they say I'm now lacking men, but I don't lack men. I'm telling you, it's not about men, because if I want to sell my body, I will not even disclose my HIV status, because I know people fear it a lot.
Exactly.
So it would be very, very helpful if we get many people like to explain for that the message not coming from me. It is research, and it's something that the WHO it said that if your viral load, if you continue to take action religiously, not like he said, not only when you have symptoms. Today I have headache, then you rush and go and take it. It's not paracetamol for headache. It is something that you have to take every day for the past 14 years. Since I was in Ghana educating people, there had never been a day where somebody would say they've rushed Joyce to the hospital because she has developed some serious infection because of HIV. I am not boasting about my health, because as human beings as we are just like vehicles. Today you're on the road, tomorrow you are down. So I am
Yeah.
not boastful of my good health, but I am
But we
boastful.
thank God for the knowledge
Yeah,
and strength
yes,
and
yes.
grace.
Yeah, that's why they say knowledge is power. The moment I was told, those days I was only aiming at miracle. When doctor says, there are medications, I don't even hear a word. All I want to hear is somebody who will tell me there is this pastor here who can. I remember a lady who said she should sponsor me to go to Pastor TB that cure me. But to hear Pastor T is not even there to cure me. So life is not just about that. Some to be submissive, you have to learn. We have advice, especially if you have a condition, you heed to doctor's advice, do what you are supposed to do. So I thank God that for taking this medication for the past 14 years, I don't go on a break to wait for the virus to rise up again before I begin to take my medication. No. But what we are talking about now is that now that we know that HIV is not a death sentence, now it is the stigma. It is human beings that are killing us, not the virus again. So one day I posted on my page that WHO organization, we have found medication for HIV, but what we haven't found is medication for stigma. Because this
Exactly.
virus is here,
Okay.
it's not killing us, but people are dying in pain. As we are doing this video, I have promised people I'm never going to show their pictures on Facebook. I'm never going to play their voice messages. Come and see people who are crying on my phone every day. Sister Joyce,
Oh.
I have HIV. Sister Joyce, I can't even tell my mother. Sister Joyce, what can I do? People are dying in pain. Imagine if everybody is able to disclose even to one person in their family. They will be supported. My mother used to support me. Joyce, get up and take your medication. Those days we set alarm clock.
Oh.
I used to take my medicine morning 9 a.m., evening 9 p.m. But now things have changed. Here in Europe, I take it in a day. So those days you stick to the time. So every time 9 a.m., I take it exactly at 9 a.m.
Okay.
That I have family support. But what about somebody who is not able to tell anybody they are afraid of death? Because at that point when you are diagnosed with HIV, When you sleep in the night, you don't see anything. You only see things roaming in your eye. It's like magic. Skeletons come from nowhere. These are the dreams you have. Yes, you only dream of skeletons. These are the psychological impacts of knowing of your HIV status. That is why I know now. I understand why most people don't want to get tested. So those days I sleep, and I cannot sleep in the night because all I see is, oh, I'm going to die one day. I'm going to be like a skeleton, and they'll put pamper adult diapers on me, and I'll do this and I'll do that, and I'll fall sick, and I'll have all these rashes on my skin. I was always crying, always in pain.
And this is more than a decade you are still alive.
Yes.
Isn't that amazing, people?
It's
People,
amazing.
Isn't that amazing?
It's amazing.
And with 4 children.
4 children.
And you have 4 children, yeah.
Yes, and I know people are still rejecting. But you know what? I said to myself, it's about time I wake up. At a point, I want to deny my status. You ask me, so I never have HIV. Go away from, because I began to deny. But at the time, God, as I was denying my status, I never denied my medication. I will come and deny in public and come home medication. So over all these years, now I decided, no, I will not lie. Even at the point where I was lying, still rejecting me. What is the point in lying? I know it's my privacy. Everybody's health status is their privacy. You choose to disclose it, and nobody can put a gun in your head because each one of us has a problem, walking about with a lot of problems. But this is the time I say, women, we are suffering too much. Somebody needs to rise.
I want to tell you something, Joyce.
I
admire your courage. Honestly speaking, I admire your courage because a lot of people are out there hiding. They are even not HIV. They already have the AIDS itself.
Yeah.
But still, they are not bold as you are to tell the public. So let even their close relations know that they have it.
Yes.
So I truly admire your courage.
Thank you so much.
All right.
That the whole world should hear. So if you go on the internet to read about you equal to you, we say we are undetectable, so we cannot pass on a virus. Why do people still reject us? The fact is that even though all these informations are there, nobody has seen physical evidence. That where are the people who say they are undetectable and they cannot infect anybody? But we are all hiding. So if we are hiding, who is to make the difference in the world? Truth be told, if everybody who is HIV positive is able to adhere to their medication like I have done, then the next generation about another coming with the virus. You know why? Because if you take a medication, you cannot pass on the virus to another person.
Okay.
So why can't you all join on? You said?
Do you know what I want to do now? You made a statement that when you are telling people about it, they think it's because you need a boyfriend. When you are telling people about it, they think you are trying to make it look presentable to people, to people. You want to, they think you just want to tell them what they want to hear.
They want to hear.
In order to bring them closer to you. Right? So I'm going to let you keep quiet now, right? And we will have Dr. Henry tell us more about it, and Famazaya to tell us more about it so that they can hear from other people and know that. And to let our viewers know, Joyce is from Ghana. I've never seen her or met her before, so that you people don't think that, oh, we planned it. No, I have never seen her. I saw her video and I was touched, right? Yeah. And Famazaya is in the US. Dr. Henry is in Nigeria, is in one of the best hospitals in Asaba. He knows what he's doing, right? So he will be there to tell us everything about it. So you will hear from another person. Okay, Dr. Henry, over to you, sir.
All right, very much. I believe you can hear me.
Yes, we can hear you, but if you can raise the volume a little bit more.
Sorry for the network problem because it's critical for where I'm coming from. So,
yes, we understand. So if you can raise the volume a little bit more, please.
First, because of our network, I'll be very fast. I don't know how much network will allow me. But first, I want to appreciate Mrs. Joy It's not easy. It's not an easy for the kind of campaign she's taking around the world. Now, having said that, number one, quickly I went out the difference between HIV and AIDS. Like rightly has said, I want to join with that. In a clear terms, you can be HIV positive and don't have AIDS. Now, what is the difference between two of them? HIV is human immunodeficiency virus. That is the virus. Ms. Joyce, when she was trying to explain sense of compliance. Now, when you are HIV positive and you keep to your drugs, like as you can see now, she's very healthy, well looking, well fed, good looking. There's no comorbidity, nothing you can see around her that this one, you said, she's HIV positive. Now, what it implies is that the condition has not progressed to AIDS. AIDS simply means that the immune system is down. It can now accommodate comorbidity. Example, tuberculosis, pneumonia, herpes zoster, a lot of infections. You see, the person starts having all infections. At that stage, we say it has progressed to AIDS. That's acquired immunodeficiency syndrome. It's a syndrome. It has a lot of components. That's number one. Secondly, I also want to re-emphasize on the issue of, I discovered from my practice for some time. I worked with in Nigeria what you call for clinical care and research, triple CRON. Is a body responsible for management of HIV, pregnancy, HIV, undiagnosed and all. Now, one of the biggest challenge we discovered, we'll get what we call serodiscordant couple. A situation where one partner is positive and the other partner is not positive. We'll get to that aspect. Then I'll tell you some of these and what we always do. But secondly, I want to point out one ways you can get this. It majorly deals with 4 fluids. Number one fluid is blood. That's number one, like Ms. Joyce rightly said, the blood is about 80 to 90%. Second one is breast milk.
Okay.
We also talk about that, how it's possible for a HIV person to be pregnant, and the child not being positive. The child will be delivered negative. We have seen it even in Africa. If you can do it even in the remote area, of course, you should know what is obtainable over there. That's number 2. Number 1 is blood. Number 2 is breast milk. Number 3 is semen, through the sex. Semen. And number 4 is fluid. So these major 4 fluids are the commonest way of contacting this virus.
Okay.
Another one is, what are the ways that we cannot get it? For example, you cannot get HIV, like she said, by hugging, by using the same spoon with someone that just finished eating, of course, there are research that kissing a bit has a very low viral load, insignificant, that cannot transmit. In fact, as a matter of fact, we discover, like where we are now in Africa, they said when you share the same clipper with someone, maybe as a man, you can salon snap clipper. Most times say you want to avoid it. The problem is not sharing your clipper or you sharing that thing with someone at that particular time. It's not HIV because research has shown that if you go use another person's clipper, it will take almost 90 years for the virus to replicate, to show in the blood that the person is HIV positive. To show you how insignificant.
90 years. Okay.
90 years. So it can tell you that it's quite long. So that's why when you meet us in the hospital, you tell us that to shave your head, this needle and all that. It's almost possible. We don't get to tempt it because research has shown that before it will take almost 90 years. We have the research on the internet.
Okay, can I ask a question? Can I ask a question? If you said it can be transmitted through blood. Now, if someone goes to the hairdressing, what do they call it? Hair salon to cut their hair and got injured, and there's a blood on the clipper. So if
Yeah,
the next person uses it, are you trying to say that that next person cannot get it?
yeah, that's what I'm saying. Now. That's why we talk about the concept of viral load and CD4 count. I'll give you a true pure clinical example. For instance, now as a lady, you go to a salon, and then you just have a minor needle prick.
Mm-hmm.
Look at the word I'm using, minor needle prick.
Minor, yeah.
Yes. What research has shown is that it is almost nearly not possible. HIV virus from that needle prick.
Hmm.
There are a lot of things to debate around it, but the summary of it is that it's almost not possible.
Okay.
But if of it has to do with this transmission, has to do with viral load.
Okay.
Viral load must be significant to be able to be picked by the because the test you are doing is an antibody test. It should be able to be significant enough to be able to pick the antibody. So it's almost not impossible. If you take a sample, if you have 10 HIV patient positive, they can clearly tell you that their major point of contact was through either blood transfusion, cellular intercourse, or children. Now, if you come to our environment, you will know what we are going through. You see a lot of course, we had one last week in our hospital. A woman did not know triplets. The children were all positive.
Oh.
As at 6 months they came to because they were not aware, they were not informed. Not informed. So there are a lot. That's why I'm so happy about this campaign. It's something that should come close to this our environment. A lot actually been going on. That's like I said, we've talked about the commonest ways to contact it. I said blood, breast milk, semen, and vaginal fluid. And we've also mentioned some other ways that we cannot contact it. I said a good example is saliva, sweat. They are not proven research. You can also contact virus from that. But it's transmitted and one person to another. Having said that, I want to also quickly add, like the we want to have an environment is pregnant women. Now, it is true that like I'm continuing from where Mrs. Joy stopped. It's possible for you to have HIV and get pregnant and don't transmit it to your baby. How? Now, when the person, a confirmed HIV positive patient is pregnant or want to achieve pregnancy, there are some tests we do, especially the ones because of the environment we find ourselves, low income resource environment like Nigeria. Two important tests, viral load and CD4 count. Now, this what happened in Africa. You hear a lot of them in church. They testify that they were HIV positive before, and after some time they become negative. Now, to us in medicine, this is what actually happened. For that is compliant with our medication.
Mm-hmm.
Over time, there are some times she will go and test, it will show negative.
Okay.
That does not mean that the person. I can tell you now, if like a resource person, Mrs. Joyce, if she at some point in her career state, if she go to lab and test, you will discover that she will be negative. That does not mean that the virus has gone. Simply means that the viral load in the blood cannot be picked at that particular moment. And the only thing that can do that is
that's the undetected stage she was talking about.
The viral load is too insignificant to be picked.
Okay.
So what the person do things in medicine? One, that the person is being compliant to his or her medication. The person is at a zero viral load state. At that woman gets pregnant, she cannot transfer that virus to the baby. And what do we do through the pregnancy medications that the patient also will be placed on in addition to some of the he or she is on during or through the her pregnancy period. What at birth. Two, the van normal. We also have erroneous misconcept out there in town that once positive, is pregnant, it must be through CS. No, it must not be CS. There are some things you said this woman will deliver on or not? If the woman is fit to go through vaginal delivery, why not? And what are those things we check? We must look at the viral load in the last 3 months. What has it been like? If it's less than, there's a value we're looking at less than 500 within that, the woman can go ahead and. But if the value we're looking at, if the woman is is it compliant with medications? If she's compliant and her viral load, you allow her to go normal. But if her viral load is not within range and she's not compliant, it's an indication for cesarean section because of the baby. And now what happens to the baby? Remember I said the second point is breast milk. What happens to the baby? If the baby is out, there is a drug we place on the baby for about 6 weeks, nevirapine. The baby will be on nevirapine for 6 weeks. And after 6 weeks, the baby will go for testing, pre-testing and all that. And we'll discover that if you're actually religiously, I like the word she used, Joyce used, religiously, that's the word we are. It's not easy. When I was in medical school, used to be morning and evening. Things have, has improved a lot better now. You can see that it's once daily. And before, it used to be plenty tablets. They will just give you 3 tablets.
Hey.
So, but now, those tablets, you can be fine. So it is quite is a lot of improvement has happened. And then the last one also I want to point because of our time. Another challenge we discover is what is called the zero discordant couples. Now, what do I mean? These are partners, especially where the husband is positive, negative, and the wife is positive, or the other way around. Now, from my experience, we discovered that it's better to be positive.
For both?
For both. Now, I'm going to tell you why. Now, we discovered that if in this the major mortality we normally have in Africa, in Nigeria, is majorly from discordant couple. Now, if not the level of this awareness, especially when a man now is, in fact, it's worse when a man is positive, when a man is negative and the wife is positive.
Oh.
You don't even want to hear it. They will tell you the woman has done all manner of first thing first, that marriage is going to end, and for the ones that didn't end, is cry every day. I told you for almost 6 months I was giving medication to these people, and it was a hell for me. I'll come back and this problem. A lady will come to clinic and cry from morning till evening because the husband is positive, the husband is negative, and why she is positive. So, and in fact, I had one during my stay there. The woman was sick and she had blood transfusion. That was how she caught, that's how she caught the virus. And then you agree with me that it's not her fault.
Yeah,
but
exactly.
Anybody that hears that she's positive, that's where we're coming to the essence of this campaign: stigmatization.
Yeah.
Everybody at that point will now tell you, why is she positive? So our point of take home also, I'm also suggesting to our dear friend Ms. Joyce that they consider special consideration should be given to several discordant couple. A lot of energy campaigns should come into that. Are they preventable measures? Yes, they are preventable measures. I've mentioned a lot. First, prevention, they said, is better than cure. And for those that are also infected with the virus, like time they don't allow me, I would have told you that there are about 4 stages of this infestation. To us doctors in medicine, our prayer is that let our patient remains in stage 1, and that's exactly where our sister is. Stage 1 is the HIV state. It's majorly asymptomatic, majorly asymptomatic, no symptom. From stage 2, clinical stage 2, you start progressing either to, you start having swelling in the armpit, and until you start infection every time the person is treating one infection or the other. It has started progressing. So that is it about that. That's for those, and for those that are infected, the major preventive measure is total religious compliance to medication. Take your fine. Nobody will. I have a lot of them. Like Joyce is even far better because someone will say I have a lot of patients here in Asaba. Like they don't tell you, you will never know.
Exactly.
You will never know. In fact, even as a doctor, you have to probe. And there are some of them that are, another important factor is education. Some of them that are literate, they understand that these things that this is my life. I have to accept and I have to be fine for myself. So that is infected. And also family support. We can overemphasize the place of family support. Society, when I mean family, including both society, church, should find a way to inculcate them. Mosque should find a way to inculcate them. The society should find a way to, especially is getting better over there, Europe, but in Africa, yeah, it works. In fact, in your village, if they say you have HIV, they will banish you. That's simple as that. So, can HIV patients get married and have children? Of course, they can. They can. It all boils down to the effort of the index patient. Is the person ready to comply to his or her medication? Is the person ready to do the basic things they ask you to do? And like I forgot to mention.
Dr. Henry, I want to say something. 1 minute.
Okay.
The stigma, even in Europe here, among African people, is even worse than Africa. So don't ever make the statement that it is better. Never try it. Never.
It's almost a global issue. It's almost a global issue.
Yeah.
So, like I was trying to talk about the breast milk, like in our hospital, we have the option. When the woman deliver, another challenge you have is, especially in Africa setting, the feel that if you deliver and you don't breastfeed your baby,
yeah, that's the question I wanted. Somebody put the question there. Sorry to cut. It says, hold on.
Are you listening? Are we together?
It says, why the newborn baby is placed on 6 weeks medication? Will the mother be breastfeeding or bottle feeding the baby?
There are places where people have children and they decide not to even breastfeed, whether they are even taking medication or not. So in my case, I usually tell the women, if you feel comfortable breastfeeding, you are good, because if your viral load is 0, you don't have a problem. You cannot even transmit it through sex. So talk about breastfeeding. If your viral load is 0. Now, the problem is the medication you're taking. Not all medications are secreted through breast milk. Not all of them. There are medications that pass through breast milk. Like it can pass through breast milk to a child. If you're taking some medication, there are medications you should not take when you're breastfeeding. But I have not seen a HIV medication that is not compatible with breastfeeding. Okay. So in that case, if the patient is compliant with their medication, they can breastfeed. That's okay. So they can breastfeed, but still, it depends on the country. Some countries or states, as we live here, will now like tell you to avoid it to prevent breastfeeding. Because where we are here in this country, they have programs that feed a child from birth to 5 years. You don't even have to bother about breastfeeding. They have programs that provide food for a child from birth to 5 years, and you may not even worry about breastfeeding. The state will be sending you what to give at any point. So here you have a choice, but not everywhere in Nigeria you may not have the choice. The only choice you have is to just be compliant with your medications, and you can breastfeed, and you will not transmit it.
Okay. So another question is, what are the effects of friends and family rejection and stigma?
I think Dr. Henry was speaking before his.
Yes, let me.
I think he may answer most of these questions as he's progressing in his presentation.
Yes, I'll unmute him.
Hello.
Okay, let's try again.
Okay, can you hear me now?
Yes.
All right. So sorry for my network once again. All right. I was trying to.
I don't think it's network. Your network is okay, but it's echoing. Do you have earphone? Can you try using your earphones?
I'm trying not to. I don't. I'm speaking freely.
try and use, if you have earphone around you, try and use it. Let's see if it will get better. Okay, so there's somebody asking question about.
Okay, so there's something about.
It's still echoing. Okay. Yeah, what will be this one? Nordica. What?
Okay. Yeah, what will be this one? Nordica.
Is echoing. Okay, thanks from Isaiah for responding and clarifying my question.
You're welcome.
All right. Okay, so our viewers, we really appreciate every one of you here. Patient Patricia Okpoko. Hi from Spain. Thank you very much. Colin Z Pro. Thank you very much for joining. Hope Patrick. Thank you for joining us. Raymond Ray. Thank you. Anointed Choma. Thank you for joining us. Rita Iseka. Thank you very much for joining us. Etuni Mabel. Thank you very much. Amaka Agagbon. Thank you for joining us. All right. Vamefile Imesco, thank you for joining us. Chichi Thompson, thank you very much for joining us. All right. Okay, so once again, I want to appreciate Joy Mensa for giving us your time and for bringing out yourself, like you said in your video, that you want to sacrifice your life for people to get to have the awareness and have the education concerning HIV AIDS. Like when I posted the flyer about this program, somebody wrote under it like, HIV not there again now. You know, so that mentality is going to lead people astray. Like it's no more, it does not exist anymore. It's still there. But the main thing now, how you manage the system and how you religiously, if you get them, how you religiously take your medication. If you not take them, should be the person go pass the virus to another person. Abi, make I not talk with it, I don't know. So make una tell me. All right, make una tell me. If una not, if the people will get HIV not take their medication, is there tendency that they pass it to their children and to their baby or to people close to them and all that? Is that tendency?
Yes, because the medication actually suppress. It's just like you have military people around the president. It's not as if that president is not assassinated or kidnapped because there are no bad people. Is that the defense system, the security system is constantly at work. So as you take that medication constantly, do not deceive yourself that the virus is dead. It's not dead.
Okay.
It's just suppressed to the point that it cannot actively do anything. It's just like one thief that has no big weapon come in a crowd of 100 people. If he try to do anything, they will oppress him and they will catch him. So when the virus tries to be active, the medication come every day, knock it down, knock it down, knock it down, knock it down, knock it down. The virus will be there. But when you stop taking the medication, just like if you do not cut your grass, it will grow back.
Okay.
And be strong. If you don't cut the grass in your house, very soon it will turn to a forest. It's just like somebody died. That place that did not even grow weed, you'll be shocked that a flat surface will start growing weed. But because leg is passing it every day, you would not know there's weed. So what Joyce is doing, we should focus more attention, first of all, in encouraging people to be part of this fight. It's not, the disease is not for the person that have disease.
Yes.
As many as are told should be telling person, did you take your medication today? Did you take your medication today? Did you take your medication today? And this is to tell people in Nigeria that in Africa that the medication is not fake. The problem is that the person taking it skip the medication and the virus empowered them. That is, it got to stage 2, like Dr. Henry said. Now you start having clinical manifestations. and most of your defense system will get to a place of irreversible damage that you cannot even like suppress it anymore. You have been overempowered.
Hmm.
So that is why, like she said in the video, what kills people more is the stigma, because sometimes you will even be ashamed to take your medication in public. Let's say you traveled now and you are with a group of friends and you are staying there for 1 week. Some people do not even have the privacy to throw the medication in their mouth. Why are you taking medication? You get malaria? No, I don't have malaria. You get headache? Why are you taking medication? So now we have to encourage people, anywhere you are, don't be ashamed. Take your medicine. Take your medicine, and don't be ashamed to even, what she has done, she has done. Don't be ashamed to even tell people. Just like you tell them you have malaria, you should still tell them I have HIV and I'm taking medication. I hope you don't mind. I'll be taking medication every day. And like Dr. Henry said, they have increased compliance of this medication that you just take it, most of them, once a day. Just once, if it's in the morning, in the afternoon. And most of them are extended release medications. Equal dose of it is released into your body at equal time. So it doesn't really matter if you have to take it at 9 a.m. in the morning or 8 p.m. in the evening. As long as you take it within a 24-hour frame, you still maintain a concentration of it to be able to suppress the viral load, to be below transmission level, or insignificant, as it's called in statistics, in biostatistics.
All right.
So that is what it is. Dr. Henry can help us, especially with explaining why the virus can be suppressed, not to go between the placenta barrier, between the mother and the child.
And the
He
child.
knows better in that. Yeah, go ahead.
Before
Okay.
Dr. Henry comes, I want to learn something from Mr. Isaiah. For the first time, I also question. Please, my question is that, we always say to people that when you take your medication and the virus is undetectable, it doesn't mean the virus is dead. When you stop taking it, to come back. Statement is the most reason why people still stigmatize her. They said, then the virus is still somewhere. Why should I eat with you? Okay, now my question is that, for example, I saw somebody whose virus went up to 200,000. The viral load test, 200,000. And when the person was put on medication, it started in until it got to 20,000. Mr. Zaya, if you say that when you are taking the medication, the virus doesn't die, so the 200,000 that dropped to 20,000, where did they go to?
No, the live virus, right? Replicates, like then they born picking, right? But when you take your medication to the point where you're able to suppress it and they are not able to born children, like the virus becomes barren, right? Because of unconducive conditions. Just like if you are a couple living in one room, there's a number of children you have. You stop having children because you don't even have time to have sex anymore, because it's not conducive. So it's not as if the virus is completely dead. The medication kills the virus, but the virus gets to some point. The virus gets to some point. They will form a cyst around themselves.
Okay.
The medication does not kill it, but it does not even multiply. Okay. But if you stop taking the medication, that is, they kind of hibernate inside your body. So now the medication did not kill it, but the medication cannot even destroy the shell. But when you stop, the virus will wake up and start having children. Then the viral load will now increase.
Okay, so that means some will die, but got to a point. The rest will
the rest will go and hide. They will hibernate. They will form a system where they just wait. But after a while, you stop taking your medication completely. They find a way and they still come back. That is what happens.
Good.
Dr. Henry can throw more light on this.
To make it funny, so the Oga Pata or the Oga Madam of the virus will go and hide somewhere.
Yeah, they will devise a means. They will devise a means Not that they are completely gone, but now they cannot replicate. The medication will not allow them to reproduce. So the load is gone down to zero. They are undetected. That's why they are even undetected. So they are undetected, but they are there. But if you stop completely taking the medication completely,
now
they will grow. It happened with all kinds of virus, or every kind of virus. That's how it happens. Even the what is it called, the coronavirus. The point is, they go into your system, suppress your system. But when you keep wearing masks, you prevent them from coming in.
Okay.
Now your body system will start fighting the ones that are there. They may be there, but the concentration is not able to cause a disease, but it's still there. But when you stop, when you lose guard, now that's when the device means to come back. It's just like thieves. If thieves thief in one place and the security becomes very, very big, some of them will become pastors, some of them will become traders, but they are thieves. But if the security lapses, you will see the man that maybe used to preach in church. When they catch him, you say, a pastor was caught as a thief. A doctor was caught as a thief. A mechanic was caught as a thief. It's not as if they were not thieves, but security was so high for them to show. Then they become mechanics. Some of them even become bricklayers. Some of them become evangelizers. But when security reduces, they go back and strike. That's how it is. Yeah, that's how it is.
Okay.
So viruses, I don't know the school they go to, but if you understand viruses and bacteria, they are very intelligent. They build defense systems.
Okay.
Yeah, they build defense system and they hide. They hibernate. They can be there for years, but they build defense systems. That's the truth.
Okay. They will be weak because you are taking the medication. So once
they may be weak, or they find a place to hide themselves to prevent themselves from completely being killed. But they are still there. But when you stop, when they are very smart, very, very smart.
I'm told
even the COVID-19, even the COVID-19 you're fighting, there's what they call mutation in viruses. The COVID-19 may have even mutated and formed a different brand that the medications for the 19 will not even affect. I don't know how they do it. I don't know who the school they go to, but they have postgraduate systems. They're advanced, very intelligent.
I know, Mr. Isaiah, viruses that vanish from the blood because they cannot stand the presence of the antiretroviral, they hide in the bone marrows and in the brain.
Thank you.
Wow, you are very intelligent too. Okay, so before Dr. Isaiah continues, someone wrote something very interesting here. It says, Mr. Isaiah, you can teach the most foolish to become intelligent. Based on your analogies. You explain points so simple for your listeners. Thanks to you all for this great educational presentation. Thank you very much, Mefile. Una not the Mefi at all. All right, so over to Dr. Henry. Let's hear you.
Okay. All right.
I'm really enjoying this program.
Okay, I was really having fun. Let me start from what my boss concluded, the point he was trying to clarify. Why do we take antiretroviral drugs? Why are we taking these drugs? It's good to understand so that it will be clear in medical terms. The first one is to delay progression, like we rightly said, which we explained, so that the person will remain as stage 1. Number 2 is to suppress replication. I'm just trying to put it in the proper, that's what Morgan has been trying to explain. To suppress replication. What it means is that it will be in an inactive stage. It will not be able to move as normal. Number 3 is to preserve immune function. Remember the 2 tests we talked about. We said one is CD4 count. The function of that CD4 count is white blood cell that fight infection. So one of the things that drug does is to preserve immune function. You remember Miss Joyce will always tell us, who can attest, that there are people that are on first line drugs, there are some that are on second line drugs. There are conditions. So it's because of some of these conditions that if they don't qualify for first line, they will not move them to second line. And why? Why am I saying this? Because of this next point. To avoid resistant virus. Most of the challenge we always have, especially around this environment too, is drug resistant HIV virus. Is something that you will not want to have, because you just keep running from first line to second line, first line to second line, because the patient ab initio was not compliant to medication. We take today, stop tomorrow, and continue next tomorrow. What you are doing is that you are building resistance.
Yeah.
So even after you still come back and go back to second line, and then with all the comorbidity attached, you see the patient will not be able to do well. And the last point is to be able to reduce transmission. So
Yeah.
these are major reasons why we are able to, take these are antiretroviral drugs. So the next point is what are the effects of friends, family rejection, and stigma? This is simple, like she rightly said. The effects ranges from short-term effect to long-term effect. Short-term effect, depression, the person feel not being part of the society, and those factors will contribute to not being compliant with medication. He or she will have low self-esteem. The
Yeah.
person will not achieve his or her goal. That your HIV positive does not exempt you from being a businessman, does not exempt you from being a doctor, does not
Okay,
exempt you
talk
from
am
fulfilling
loud.
your life,
Talk am loud. They need to hear this.
your life dreams. So
Oh.
it doesn't prevent you from fulfilling your life dreams. And the long-term effect is it brings their death closer. Like she rightly said, it's not HIV that kills in the most cases. It's the psychological trauma that comes
Yeah.
in. It brings the comorbidity. The person will start developing hypertension.
Yeah.
From there,
Yeah.
the person start developing stroke from HIV, and all this will make the person, to pass on very quickly.
Yeah. Yeah.
The place where things are working, the society is being supportive, the family is being supportive, everybody involved understand that
Yeah.
these people, it has happened already. Where we are now is how can these people be integrated back to the society with minimal or no effect. Let them not feel the effect of this. In fact, in the hospital, if they present hepatitis C virus and HIV, a layman will run and go and pick hepatitis. He said, no, I don't want HIV. But do you know that hepatitis is worse than HIV?
HIV.
Really?
So HIV is no longer a death sentence like where we started from. So the essence why I'm saying all this is, I'm already going to the number C that say what is the advice to the people.
Yeah.
The advice to the
Dr.
people.
Dr. Henry, to advise, go to advise with the stigma. It's when we are talking about stigma.
Yeah.
People think we are. Sometimes people think I'm too much. I am exaggerating. I am not exaggerating. Stigma that sent me to psychiatrist hospital in Germany because I lost my child.
Okay.
Yes, in a party, they threw my plate away. They didn't even wash it. So you see, this kind of things I've been through. The rejection, they ejected me from my house. I was sleeping on the street in Accra. I want to use this platform to beg people. I want to beg people, stop stigmatizing us. Because of this, my child has been taken because they don't understand why I have depression. When I remember all these things and what people are still doing to me, sometimes I said in a video,
you're already a warrior.
Yeah, but sometimes it's breaking that I told myself that I will never infect anybody. But people should understand that the stigma where adhering to medication, my virus acceptable, I pose no risk to me. They throw my plate at party. How many people can survive this?
Oh,
please. I want to use this medium to beg people.
You don't need to bring in. You've done well for yourself. I believe your generation will always remember you for this.
Please stop crying. Wipe your tears. See how beautiful
you don't need to get emotional about it.
See how
So
beautiful you
I'm
are.
proud of you. I'm proud to be associated
Oh
to
God.
you via this program. In fact, I will be grateful if I can even hook up to you personally after this program.
Yeah.
You've done much for our
Thank you.
generation. This is what we need. You are a hope. You are, a hope to us, a beacon of hope to us.
Oh.
Thank you.
I
Thank
want
you.
to use you someday to give example to people. I want to call you any day, anytime, and tell you, speak to this person. She has brought hope to thousands over there
Yeah.
around the world.
Yeah.
You are doing a
Yeah.
great job.
Thank
So
Yes.
thank
I beg you, just be of good
Be
cheer.
strong. Be
So
strong.
is the advice generally, like I was saying,
Mm.
is like she has definitely practicalized the whole drama. The thing is, let's open hands for them.
yeah.
It's not some of these people got this in one out of ignorance. It was not their making. And my consultant will always tell us like that somebody is HIV positive does not mean that the person is morbus. Let's understand that fact. There are a lot of them. In fact, it is even the ones that got it through Novi. You heard that story at 18, she 18. She
19.
has been fighting this
19.
battle since 19. So you can accept that, but there are people that have been into this thing, but they are not positive. Those are the phase of life. So let's understand that is not to their making, is making, is not their own part. I'm from one part in the reality of life. God has a reason for everything. Always tell them each time I have this kind of situation in my hand, I switch from medicine to God. And what do I always tell them? That thank God is HIV that you have. That does not mean the person is not going to make heaven. It's not a criteria. God does not look
Yeah.
at those things. Do you understand? So
Yeah.
you're going to have good life here on earth. You're going to get married. You already have your children. Your children one day will
Yes.
get
Have
married,
children.
and then you're going to be a light. So the number two is the issue of compliance. For those that my advice is in two ways. For those that are already affected, let them open up. There are a lot of them. In fact, I had one. I'm telling you from experience. I had a lady that came for antenatal booking. She told me she is HIV positive. And I said, is your husband aware? Because we want to find out, is your partner aware? She told me over her dead body. So I
Oh.
now found out, I became more interested in the story. So I now asked her, what happened? She said the first husband she married gave her this HIV,
Uh-huh.
and the man didn't tell her, and the man died. So, and she's positive now that she's not going to tell anybody,
Oh.
including the one she's currently marrying. And as I was talking to you, she was pregnant.
Oh.
Now she has endangered the life of that man. That man will not know anything. He will just be going as if, nothing is happening. And you see, so it makes the man in turn, if the man is not a responsible man, already affected, you go out society, it becomes a chain. And the chain will keep increasing. So let those people own up, come up as separate, start taking your medication. The earlier, the better. In fact, the WHO principle of management now is test and treat. That's what they are doing now. Test and treat, test and treat. Before it used to be you give the person like 3 months. If the person is not asymptomatic, leave the person. But now, since 2010, it's test and treat. You catch them the very first day the person tests positive, you commence highly
Treatment.
active antiretroviral drugs. So that's for those that are affected. Compliance. There's nothing like compliance. Not it must be totally compliant. I was before the network disconnected me. I was trying to tell you a story where in our low resource area like in Asaba here, most of them when they deliver, they will tell us that um, if they come and visit them, they're not breastfeeding. That means they are not strong women. Like I told you, we always try to. There are two ways we tell them for breastfeeding. There's one that is called total exclusive breastfeeding. For we here in Nigeria, because we discuss of this thing also happens to people that cannot even earn 10,000 naira a month. They don't even know what it means to come and start buying what's it called, NAM and all that. They don't have the means. And at that point, they have to resort to what they have. So what we always, number one, on if you can breastfeed only, it's not breastfeed today, tomorrow you give Akamonet. No. Exclusive breastfeeding all through this period that we're trying to, expose this child. And the good news about it that in God also works in his own miraculous way. We discover most of them too. Turns out negative, those baby. But
Yeah.
the principle must be exclusive. And the second one is we call it breast milk substitute, BMS. That one you get if the person is well to do, get your nan. Only don't miss with what we don't want. In fact, another campaign point you should also be discouraging them. Another thing that endangers children so much is misfeeding. The woman is giving breast, its milk, and is giving food that it's going to expose the gut of that baby, and the gut of that baby will so damage on time, and the baby in no time will come down with HIV. So we don't encourage that in practice. It's either you choose to breastfeed or you don't. You must choose either of. So that's one thing. And then one second group of advising. There's what is called pre-exposure prophylaxis.
Yeah.
What do I mean? There are people, for instance, if someone is raped, and in fact, as a protocol of management, must take PEP. Someone is being raped and get within 72 hours, within 24 hours, especially within the first 24 hours, you must, take PEP. Another one is for us health workers. In fact, during my house job days, I've been privileged. I also took PEP. If you have needle prick either in the place of your work or you have transfusion and all that, you must take PEP.
Is PEP a medication?
Just for 1 month.
Yeah,
Yes,
it's HIV medication.
It's a tablet.
Oh.
Yes, you take it for 30 days. Pre-exposure prophylaxis is a drug given to those that are exposed to HIV within 24 to 48 hours.
Okay.
So I'm just telling you the conditions now. You have a sexual contact, now aware of the status, immediately you rush back to the hospital. You are a candidate for PEP. You have what's it called? Exposure. Either through as a health worker and all that, you can quickly rush for PEP.
Yeah.
And then for those that are taking the medication, the campaign should be compliance. And then to the society, the advice should be support. Support comes in any form, emotional support. There are a lot you can do for them. They tell you someone to keep things were told in a clinic with confidentiality. Keep their secret for them. They come to you, then trust their secret to you that this is have been exposed. You are expected to keep to their secret, not even their partner. If they say, don't let my partner know, you are not obliged to do that. So that is it. So it's multifaceted in nature. And I believe when you do all this, forget it. I've seen patient 70, when I was in triple CRON, you see 70-year-old coming to take his drug happily with his newspaper. Nothing, and they tell you I've been on them. In fact, I had one say I've been taking this drug since over 20 years, and you will not know anything. You will not know anything. So, in summary, HIV is not a death sentence. It's something that is not a death sentence. As a matter of fact, you can have the best of life when you keep to the do's and don'ts.
Oh.
Thank you.
Thank you.
Thank you very much, Dr.
I have a question.
Yes,
I have just a question for him. Yeah.
Thank you very much. Thank you. I am really enjoying this program. I wish we can keep it like on and on and have you both, three of you speak and let me just listen. And our viewers, I hope you are enjoying the program as well. Thank you very much for joining us and help us to do this campaign. We want the whole world to hear that whoever that is HIV positive is not alone. And society should please support family. Make una not run, leave them alone, because now that one key pass the virus even. Not be say you hear say your brother or your sister get HIV. It can't be like say na juju calabar for where you dey again. I beg, make una support them, hug them, eat with them, encourage them to take their medication. You not go get them through the same process. Okay, make we allow.
Rosalind,
Center. And these drugs, including the investigations, are totally free. There's nothing money. People are organizations, abroad, they are spending heavily billions of dollars to provide these medications free for them. So it's totally free. In fact, as a matter of fact, if you're HIV positive and you are pregnant, it's also free, both for the baby and everything. So they are really encouraging people to, it's just that people are not owning up. It's totally free everywhere.
I heard from somebody that he gets some nurses or some doctors where then go collect them from hospital go dey sell am give some patients. So how they'll take track those
true.
kind of people down?
The problem is that, of course, you cannot remove you cannot solve human's problem. But our advice has always been, why did you go to meet the doctor? Why did you go to meet the nurse? They have centers that are administering this drug. Most of them will now go behind because they don't want to come out public. They go behind and meet the doctor or the nurse. So
Exactly.
eventually you will be extorted.
Mm-hmm.
So if you don't want to be extorted, like I said, now, in fact, the government is strictly against it. If you are caught doing that, is a criminal offense.
Okay.
So it's a matter of fact, they don't hold the drug. Nobody can bring the drug for you at home. You come to the center, they are trained personnel, not just doctors, nurses, pharmacists. It's a complete clinic of its own. Triple CROM is a complete clinic on its own. So it's not just HIV they are managing. Why did they do? For instance, now, like I told you, one of the things we look at for people that have HIV is cough, chronic cough. So when someone, a HIV positive, for over 2-3 months and the person is having cough, it gives you a signal as a doctor that this patient is already progressing. As a matter of fact, you start screening that patient for TB. And once you start screening that patient for TB, including those screenings are also free. You are not paying for them. In fact, GeneSpart, there's a test we do for them. GeneSpart is expensive. If ordinarily you go and do it in Nigeria, it's about the cost of 20,000-25,000 or so. I stand to, but these tests are free, as a matter of fact, as I'm telling you, in almost all the federation. I've been to about 3 states now. I've practiced medicine in about 3 states, and I can tell you it is totally free.
Wow.
So encourage them to go to
at least something is free in Nigeria.
Yes, it's free. It's free.
Okay. I'm so glad to hear that. All right, our viewers, if you have any more questions, throw it now. Otherwise, we're going to call it a day. Pamazaya, do you have more questions? Or yes, somebody
No,
asked.
okay, go ahead.
Okay.
Yes, that's why I work. FM as a specialist hospital.
All right.
Obstetrics and
How do we
gynecology. Yes.
prevent the nearest person from? Okay. So somebody say no, not with this one. Somebody say, how do we prevent the nearest person from contracting HIV, e.g., husband and wife?
Okay. One, the what we always tell them, I'm going to tell you practical things. Now, that's why we emphasize on is in 2 ways. One is if the woman's viral load is almost minimal, there's what's called infectivity stage, carrier stage. That means at that stage, the woman cannot transmit the virus. Of course, we encourage safe sex. But if the woman is not religious and not compliant with her medication, no to unprotected sexual intercourse.
Okay.
So the catch is dependent on the state of the infection. Is the woman viral load okay? Is her CD4 count okay? That means she cannot transmit the infection. So more importantly, especially if they are married, they are couples, they need follow up in the hospital by the doctor. So what we do eventually when they come is for us to in fact, if for one of the things we do for serodiscordant couple is that the partner test every 3 to 6 months.
Okay.
For some of them, of course, fortunately, we have some of them that are compliant, that are religious. Of course, they've come to understand their faith that my wife is positive, I'm negative, or my husband is positive, I'm negative. So every 3 months, we encourage them to come for checkup, both partners, so that we can pick it as early as possible.
Okay.
So in the nutshell, it depends on the state of the viral load. And secondly, if they are not partners, of course, we always preach unprotected sexual intercourse is a risk.
Okay.
That's the major route where people get these things. Avoid them. If you can, if you're not abstain, make sure you use protection. We have a lot of good condoms out there, in the pharmacy shop. Use as much as you can, but don't endanger yourself. Just know that for any time you're having a sexual contact with any positive patient, especially the uncompliant ones that are not on medication, is a high risk to power 10. Is a high risk adventure. So
okay, so our dear brother, I hope you hear. So the nearest person near you be husband or wife, not mean say the person go carry him, but the whole work be on the person wey carry am hand, be say the person no get in ten tion to pass am give you, you no go get am. Why? Because the person go dey take im own medication religiously, e no go dey miss am to make the virus weak, and also dey follow all the protocols wey dem say make dem follow, then e no go pass am to the other person. Na only those people wey dem know say dem get am already and dem get the in ten tion to pass am give to other people, dem no go tell you, na those people dey quick dey pass am give people. And also, abeg, if you get am, no dey hide am because e no dey kill. I know say the stigma wey once people hear say you get am, dem go come dey avoid you. Na that stigma and the rejection na im dey kill people now, na im make people dey keep am to themselves. So general public, please don't reject anyone with HIV positive result. Don't reject them. They are human being like you, and they have every right to be happy like you. Abeg, na there my advice reach. So make I let Farmer Zaya give im own talk or question or advice, then we call it a day. All right, sir.
This is more of a question to Dr. Henry. When I was in Nigeria about 20 years ago, we used to work with USAID, and every pharmacy was given a section of it free condoms for people. You are allowed to collect as many as you want for free, and it's supplied by USAID. I don't know, does your HIV center in your hospital, do they have a provision for people that have not even contacted the regular human beings? That do they give out free condoms still, or do they have centers in every state where that is done? I don't know if it's still applicable.
Okay, like I rightly said, I told you that with the current policy now, like using Delta State as a case study, they are doing it at the local government level.
Okay.
Fortunately, my hospital happened to have one of the centers and almost the headquarter of the centers. Now, what they do is that we have all these their condom. In fact, I saw them last month. They were doing their campaign and all that, using female condom. That was actually their goal as at that last month in my hospital. They were just trying to encourage the use of female condom to prevent HIV. So it's still there. These things are still there, but just that, of course, you don't expect it to be as common, compared to your days.
Okay.
Things are getting a bit, economy is getting so good. You can agree with me. So they don't make it that free again, of course, but they will always place it as strategic points, especially during their outreaches. If they go for outreaches, they make these things free for for populace to benefit from.
All right, thank you very much. Okay, so did he answer your question?
Yes, it is, and I thank anyone who listens. So you can ask wherever you are to know where you can get these resources. I believe maybe in Agbo, Central Hospital Agbo, they will
General
have
hospital, yes.
general hospital where they do
Yes,
it,
they
or
have
the
a
local,
very big center,
or the
very
health
big.
center. I don't know. Yes.
Okay, somebody is asking, how do HIV patients prevent her unborn kids from having it?
The first question we should ask is the patient compliant with her medication? If the patient is compliant with her medication, it saves about 90% of the questions which implies that the possibility of transferring that to the baby is almost less than 10%. That's number. Number two is that at the point of delivery, there's what is called birth preparedness, birth plan. They must draw a birth plan between the patient and the doctor, and the birth plan will boil down to the patient's viral load. Like I rightly said, the choice of delivery very important. Part of the things in that birth plan include the route of delivery. Is it through cesarean section? Is it through normal delivery? And these choices will be informed by the patient via the CD4 count and the viral load. Okay, so if the viral load, like I said, is minimal, they may not be able to transfer to the baby, but it's a protocol that for every baby, baby delivered of a positive woman must go through this 6 weeks nevirapine, therapy. The essence of this nevirapine is to reduce. Research has shown that administration of this nevirapine within the first 6 weeks has reduced significantly the number that should have otherwise be positive. So we'll find out that if there are 10 babies that that will undergo this therapy, about 9 over 10 will come out negative. So that's why is a protocol, especially in our area in Africa, is a protocol for every baby, 6 weeks nevirapine. And we've been getting results with it. Thank you.
All right. Thank you very much. I hope that answers your question. All right. So somebody was calling me on Facebook Messenger. If you can call this number on the screen or write us your question. Otherwise, in the next 5 minutes, we'll be ending this program. If I don't have any more questions, I will have to end the program. Dr. Famazaya, so give your own general advice to our general public, to the young people, most especially the youth, young girls and boys, where they think, say, this life, tomorrow not day. So give them your fatherly advice and advice as a farm. I muted you. Let me unmute.
My advice to listeners is that first of all, like it has been said over and over again, HIV is not a death sentence. Number one. Number two, if you are having a relationship to someone you are not married to, and the person that you're having a relationship with, you are not married yet, so you are not even ready to have children, always have it at the back of your mind that unprotected sex is not only to prevent pregnancy. You should have it at the back of your mind that HIV is still there. You should stay protected. So you should not only be conscious of coronavirus to wear mask. It's like you wearing a mask. You should always stay protected. Be conscious of it because it is something waiting for you. Number one. Number two, when people are trying to get married, people are only conscious of genotype, whether you are ASAA or SS or something. No, people should always, like in the state of Georgia, it used to be before you get married to somebody, one of the things is that both of you have HIV test. They did it so that you know where you are and include it in your planning as a couple, how to live as a couple. So that you decide whether to marry the person and you have plans to keep it at the serum concentration at 0 level. So always have it at the point back of your mind that genotype test is not the only test required. Both of you should have HIV test, just between yourselves.
Okay.
And if the other person is positive, it is not a death sentence. You can still marry. But both of you should work hard to keep it from infecting the other partner who is negative and infecting your unborn children who will come later in life. So that should be one of the challenges you have to live with in life. But to crown it all, compliance with prevention and compliance with medication if you are positive is the most effective way to reduce even the depression that comes with it or the stigma or anything. Compliance is very necessary.
All right. Thank you very much. So viewers, when I don't hear, compliance is very, very necessary. If they carry medicine give you, not wait until you get headache before you drink them. According to Joyce, she say the medicine not be paracetamol or Panadol for you to go drink them when you get headache or cough. Now medicine where if you know say you want stay alive and look healthy, you will need to take this medication every day according to how they say may you take them. And also you need to always at the times wey dem give una to always go for your checkup to make sure say the wetin una call am e no increase or so na so. All right, viewers, thank you very much for joining us, and I want to appreciate Dr. Henry. In your over busy schedule, you created time for us to educate us on the issue regarding HIV AIDS and the stigma, and also Famazaya, I also want to appreciate you because even right here, right now, you are still busy. So I really appreciate you for joining us. And viewers, I thank you for creating time to sit here for 2 good hours listening to us. We really appreciate you. And most especially, I want to appreciate Joyce Mensa for making yourself available, for using yourself as a sacrifice for others to see. Because a lot of people are dying in pain, in silence, in secret, because they don't want the world to know their pain. They don't want the world to know their predicament. But you choose to expose yourself. You choose to let people know about you. And I also want to say, be strong. Whatever you face out there, be strong. Don't let anybody put you down. Don't let anybody tell you otherwise. You are beautiful, you are a strong woman, and you are a kind-hearted person. Even though say then throw away your plate, say because if they touch your plate, then go give them. It doesn't take anything away from you. You are who you are. Go home, look yourself in the mirror, and tell yourself that God created you on a very beautiful Sunday. Thank you very much for joining us. And until next time, I remain my humble self, Rosalind, and I'll see you again on GSME TV. I beg, if you know, say you never subscribe to our channel, make you go hit the subscribe button and the notification button. And also, do us a favor to share this video because we'll not just spend these 2 hours for nothing. Share out this video. Everybody wey dey inside this category of HIV positive, make dem listen so that dem go hear. The people wey dey plan say dem wan go, dem no go tell anybody, dem wan go pass the virus, dem wan go share am, make dem watch this video so that they will have a change of mind. And the people wey dey skip their medication, make dem for learn. So help us, do us the favor to share this video. Join in this campaign, and may God richly bless you as you do so. Bye-bye.